Men over 60. A urologist reveals 3 shocking mistakes that permanently damage nerves. If you're a man over 60, you've probably noticed your body doesn't bounce back quite like it used to. But did you know that a very private habit, something you've likely done the same way for decades, could now be actively harming you? Most men assume that this is one area of life that never needs to change, that it's harmless. But the truth is, after 60, your body has changed dramatically, and continuing with the same habits from your youth could be causing silent and serious damage to your nerves and your circulation. And this isn't just an opinion. This is grounded in medical fact. The science is very clear. As we age, our blood vessels lose their elasticity. Our nerve endings, they become less sensitive. And yes, our testosterone levels drop. These are not debatable points. They are simple physiological facts of life. And I've seen the consequences of ignoring these facts firsthand in my own clinic. I have treated countless men, good men, who developed permanent numbness or chronic discomfort, all because nobody ever told them that their technique needed to adapt with age. I'm Dr. Audrey Wells, and in this video, I am going to share the 3 most dangerous mistakes that men over 60 are making right now. More importantly, I'll give you a simple, safe protocol to protect your health for the long run. So please stay with me, because what you're about to hear could prevent a truly irreversible injury. All right, let's get right into the heart of the matter. We're going to begin with the first and truly the most damaging mistake I see in my practice. Mistake number 1, using a death grip. Now, here is the critical mistake that so many men fall into without ever realizing the danger. As you get older, you notice that your sensitivity has decreased a little, and so the instinct, the gut reaction, is to apply more force, to grip harder, to squeeze tighter, thinking that more pressure will equal more sensation. This is a dangerous, dangerous trap, and it can cause permanent damage. So, why is this so harmful? Let's talk about the actual biology here. Your body contains very delicate erectile tissue. These are spongy, blood-filled chambers, surrounded by a complex web of sensitive nerve pathways and tiny, fragile blood vessels. When you squeeze with excessive force, you are physically compressing those delicate structures. You are quite literally crushing them. Over time, this constant pressure cuts off healthy blood flow, and it damages those crucial nerve pathways. This isn't just a theory. There is a specific medical term for this. In medicine, we call it pressure-induced neuropathy. Neuropathy, it means nerve damage. Damage that is caused by repeated physical trauma. And in the most serious cases I've seen, the numbness that results from this can be permanent. Permanent. Let me give you an analogy to make this crystal clear. Think of the nerves in your body like the delicate hair-thin wires you'd find inside a pair of expensive headphones. Now, if you constantly bend and pinch and crush that headphone cable in the same spot day after day, what happens? Eventually, the signal stops getting through. The sound becomes distorted, and then you're just left with silence. No matter how high you turn up the volume, the connection has been broken. That is precisely what you risk when you use too much force. So, what is the solution? How do you fix this? The safe medical approach is something I call pressure titration. It is the exact opposite of what your instincts might be telling you to do. You start with the absolute lightest touch possible, a touch that produces any sensation at all, even if it's faint, and then you wait. You must allow your nervous system 10 to 15 seconds to fully register that sensation and respond. Give those nerve pathways time to wake up. Then, and only then, do you gradually, slowly, increase the pressure. The goal here is a gentle massage, not a mechanical grip. It is about coaxing a response from your body, not forcing one. This brings me to the story of a patient of mine, a gentleman we can call Robert. Robert was a 68-year-old retired school teacher, a kind man who came to see me because he was distressed. He told me, he said, "Doc, I can't feel much of anything anymore when I'm with my wife." He felt like he was letting her down. He was losing his confidence. So we talked. And after a careful discussion, the truth came out. Robert revealed that he could only achieve an orgasm when he was alone, and only by using a grip so intensely tight that it would often leave red marks on his skin. That was the smoking gun. It was a classic, undeniable sign of years and years of progressive nerve damage from excessive pressure. It took months of careful work and retraining for us to help him begin to resensitize that damaged tissue. He had to unlearn a lifetime of habit. So, if this idea makes sense to you, if you're understanding the importance of this gentle approach, do me a small favor. Go down to the comments right now and just type the word gentle. It really helps me know that this crucial message is getting through. Okay, let's move on to the second critical mistake. This one is less about how you do things and more about how often. Mistake number 2, masturbating too frequently for your body's new recovery clock. Now here is the pitfall. So many men, they carry a daily habit that they formed back in their 20s or 30s, straight into their 60s and 70s. They don't adjust the frequency. They just assume that if it was okay then, it must be okay now. But your body today is not the same body you had 40 years ago. It simply cannot keep up with that kind of demand anymore. And continuing that high frequency is not just unproductive, it can be actively harmful. So why is this? Why does frequency matter so much more now? It comes down to 2 key biological systems. First, your prostate. Your prostate gland is responsible for producing about 30% of your seminal fluid, a vital part of the system. But after the age of 60, your prostate needs significantly more time to replenish those secretions. When you engage in this activity too frequently, you are essentially forcing your prostate to work overtime, day after day. This constant state of demand can lead to inflammation, chronic discomfort, and it can even be a contributing factor to prostate enlargement, which I know is a major concern for so many men. Second, it disrupts your hormone cycles. Frequent ejaculation can throw your natural testosterone rhythms out of balance. Instead of feeling energized and satisfied, you end up feeling drained, fatigued, even irritable. Your body is telling you it hasn't had enough time to reset. This isn't just a theory. It's a pattern I see repeatedly in my clinical practice. I've seen so many men develop what I personally call ejaculatory fatigue syndrome. The signs are very clear. Each subsequent orgasm becomes less satisfying. It takes longer and requires more effort to achieve. And afterwards, there's a feeling of being depleted rather than fulfilled. This is a clear signal that the body is being pushed far past its natural recovery point. Here's a simple analogy. Think of your prostate gland as a small, highly specialized factory. Back in your 20s, that factory was brand new. It could run 3 shifts, 24/7, without any issues. But now, in your 60s and beyond, that factory is designed to run one solid, high-quality shift. Forcing it to do more, to run around the clock, doesn't increase output. It just leads to equipment breakdowns, worker fatigue, and a lower quality product. So, how do you apply this knowledge safely and effectively? What is the right frequency? Based on years of clinical observation, the safe and optimal frequency for most men over 60 is once every 48 to 72 hours. Let me repeat that. Once every 2 to 3 days. This is the sweet spot. This is the time frame that allows your entire system, your glands, your hormones, and your nervous system, enough time to fully recover and reset. As we age, the mantra must become quality over quantity, and the results speak for themselves. I have had dozens of patients. men from all walks of life, who made this one simple change. They switched from a daily habit to one that respected this recovery window, and they reported back to me that their experiences became significantly more powerful, more satisfying. They told me their daily energy levels were better, their mood was more stable. They simply felt better overall. It's a small adjustment that yields enormous benefits. Now, I'm genuinely curious about this. For many men, this information is brand new. So if this 48-hour rule is something you haven't heard before, please go to the comments section and just type the word recovery. It helps me understand what information is connecting with you the most. This brings us to our third, and in many ways, the most fundamentally misunderstood mistake of them all. This is the one that is so often overlooked because it's rooted in a lifetime of assumptions that, for an aging body, are no longer true. Mistake number 3, masturbating without proper lubrication. Now, the biggest misconception, the critical mistake that I have to correct almost every single day in my urology practice, is the deeply ingrained belief that lubricant is only necessary for partnered sex. This is an idea that, for many men, is simply a given. It's a belief that's often passed down implicitly, a habit formed in youth when the body was awash with natural oils and elasticity, and it was never questioned. For generations, lubricant was seen as something almost remedial, something you only reached for if there was a problem. But from a modern medical standpoint, and I cannot stress this enough, especially for a man's body over the age of 60, this belief is not only incorrect, it is genuinely risky. Holding on to this outdated idea is an open invitation to a host of painful, frustrating, and entirely preventable medical issues. It is a habit that must be unlearned for the sake of your long-term health and comfort. So why? Why does something so simple become an absolute non-negotiable as we age? The answer isn't complicated, but it is incredibly important to understand. It comes down to 2 parallel biological changes that create a perfect storm for potential injury. First, let's talk about the changes in your skin itself. As you age, your body's production of collagen and elastin, the proteins that give skin its firmness and elasticity, naturally slows down. The epidermis, which is the protective outer layer of your skin, becomes measurably thinner and less resilient. It holds less moisture. It has less of a fatty protective cushion beneath it. This means the skin, particularly in delicate areas, becomes far more susceptible to irritation, friction, and physical damage. It's simply not the same resilient, durable tissue it was when you were 25. The second change is the decrease in your body's own natural lubrication. In your younger years, the bulbourethral glands, also known as Cowper's glands, produce a pre-ejaculate fluid that provides a significant amount of natural lubrication during arousal. As testosterone levels naturally decline with age, the output from these glands often diminishes. For many men, it can decrease significantly or even disappear entirely. This is a normal, expected part of the aging process, but it removes a crucial protective barrier that you once took for granted. When you combine these 2 factors, thinner, more fragile skin on one hand and a significant reduction in natural lubrication on the other, you create a situation where dry friction becomes the enemy. This friction creates microscopic abrasions all over the skin's surface. Now, let me be clear. These are not large cuts you would see with the naked eye. They are tiny. But they are more than large enough to break the skin's protective barrier and act as open doors, wide open entry points for common bacteria to invade the deeper layers of the tissue. This can lead to a cycle of painful infections, chronic inflammation, and a host of other problems. And this isn't just a vague possibility. It has a direct, documented medical basis with a specific diagnosis. These constant microabrasions can lead directly to a very uncomfortable and persistent condition called balanitis. Balanitis is a painful, angry, red inflammation of the head of the penis, often accompanied by itching, burning, and sometimes even a discharge. It can make any kind of contact, let alone sexual activity, incredibly painful. What's even more concerning from a long-term perspective, however, is the cumulative effect of this repeated friction. Every time your body heals from these tiny injuries, it lays down a minuscule amount of scar tissue. Over years, and even decades, of this repeated dry friction and healing cycle, scar tissue can build up. This process is, in effect, a form of callousing. And this scar tissue is not the same as healthy, nerve-rich skin. It is less flexible, less elastic, and most importantly, far less sensitive. You are literally, slowly, and permanently reducing your own capacity for pleasure by causing this repeated, low-grade trauma. You are creating calluses on what should be the most sensitive part of your body. Let me give you a very clear analogy to help you visualize this. Imagine you inherited a beautiful, priceless piece of antique furniture, a mahogany desk, perhaps. The surface has a deep, rich varnish, and it's incredibly delicate. Now imagine you decided to polish that desk, but instead of a soft silk cloth, you chose to use a piece of rough 60-grit sandpaper. You wouldn't do it. You'd know instinctively that even if you were gentle, the abrasive nature of the sandpaper would create thousands of tiny, deep scratches. You would be destroying the very finish you were trying to preserve, leaving behind a dull, damaged surface. That is exactly what dry friction does to thinning, aging skin over time. So, what is the correct way forward? What is the safe medical solution to this problem? Thankfully, while the consequences are serious, the solution could not be simpler or more accessible. The rule is this, and it is absolute: always use a high-quality water-based lubricant. This is not a suggestion. This is not a luxury. After the age of 60, this should be considered an essential and required safety measure, just like wearing a seatbelt in a car, and the type of lubricant matters. I specifically recommend a water-based formula for several key reasons. It's easy to clean, it doesn't stain fabrics, and most importantly, it is safe to use with condoms, which is critical for men who are also active with partners. Look for products that are labeled hypoallergenic and pH balanced to be extra safe. Even more important is knowing what ingredients to avoid. When you're at the pharmacy, turn the bottle around and read the label. If you see glycerin or glycols, put them back. These can become sticky and actually contribute to irritation or yeast infections. Avoid parabens, which are preservatives that can disrupt hormones. And absolutely avoid anything with artificial fragrances, flavors, or colors, as these are common irritants for sensitive skin. A good, safe, effective bottle of lubricant is not a major expense. You can find excellent doctor-recommended brands like KY Naturals, Good Clean Love, or Sliquid at any pharmacy or supermarket. It's a small, one-time investment of usually just $10 to $15. Think about that. For the cost of a couple of cups of coffee, you can prevent a tremendous amount of pain, discomfort, and potentially save yourself from several very expensive visits to a urologist's office like mine. And the way you use it is just as important. You must apply it first. At the very beginning of the process, do not wait until things start to feel dry or uncomfortable. Apply a nickel or quarter-sized amount generously. This is about prevention, not rescue. The stories I could tell you on this subject, they are countless. I have treated so many men in their late 60s and 70s who come into my office deeply frustrated. They present with recurrent, painful infections that just won't seem to go away. They've been prescribed antifungal creams, antibacterial ointments, everything under the sun, and the problem keeps coming back. They are at their wits' end, and in a huge, truly significant number of these cases. After we've ruled out other issues, the ultimate lasting solution wasn't some powerful, expensive antibiotic. It was a simple $10 bottle of personal lubricant. It is a foundational, essential part of safe, healthy self-care as you age. It is the single most effective tool you have to protect your skin, prevent infection, and preserve your nerve sensitivity for the long, healthy years ahead. All right, to bring everything together for you, it all comes down to those 3 critical keys to safety. First, be gentle with your grip. Second, respect your body's need for recovery time. And third, always use proper lubrication. But knowledge without action is just entertainment. So here is your simple 3-step action plan for this week. Think of it as your doctor's orders. First, the next time you're at the pharmacy or the grocery store, pick up a quality, water-based lubricant. Put it in your basket. That's step 1. Second, the very next time you engage in self-pleasure, I want you to consciously, deliberately, start with the lightest touch possible. And wait, give your body time to respond. And third, pull out your phone or a calendar right now and mark it for at least 48 hours from now. Honor that recovery window. Now, I know what some of you might be thinking. I know it can feel a little awkward, even clinical, to think about a lifelong habit in this way. But please hear me on this. This is not about shame. This is about smart health maintenance. It is no different than checking your blood pressure or watching your cholesterol. Your body has served you well for many decades. It has earned your respect and your care. And remember, this isn't really about performance. Not at all. This is about protecting your body. It's about having the ability to maintain your health, your vitality, and your independence for the next 10, 20, or even 30 years. Taking control of this is a profound act of self-respect. So, if you are committed to taking care of your health with me, I invite you to join our community. Hit that subscribe button so you never miss these vital health guides. And more importantly, I want you to go to the comments section right now and write 2 simple words. Day 1. This is your public commitment, a commitment to yourself and to all the other men here who are on the same journey. Thank you for investing your valuable time with me today. In our next video, we will discuss the surprising and incredibly important link between simple hydration and your erectile function. You will not want to miss that one. Until then, stay informed and be well.